A Beyond Belief is a podcast by, for, and about people who have found a secular path to sobriety in Alcoholics Anonymous. Hello, is anybody out there? This is your humble host, John, and thank you for joining us for another episode. You might remember a couple of weeks ago we had Sam S. on the podcast, and she was talking about the issues surrounding educators in recovery. And during that episode, I had asked if there were any other professions, doctors, lawyers, whoever might want to talk about the issues they face in recovery, to please send us an email. And fortunately, we did get a response from our guest today, who is Rich S. He is a physician from Portland, Oregon. And I'll just read you a little bit about what he wrote in his email as kind of a way to start this off. He wrote, "The stigma of addiction in the medical profession is real, and it is strong and persistent. As you know, mental health and addiction issues are higher in the health professions than in the general population. Despite this, we struggle asking for help. There are many reasons. I believe that many of us have codependent tendencies. We want to be the healers, not someone needing healing. As for me, I put myself in a position financially with my family, professionally, where I felt I didn't have any choices. My one choice was alcohol to escape. With regards to the current COVID situation, I worry for my fellow professionals. We are painted in the media and popular culture as superheroes. That's a lot to live up to in a time when many of us are suffering from endless work and no time to grieve or give ourselves self-care. I fear that addiction and mental health issues will soar as the COVID crisis continues." Well, welcome to AA Beyond Belief, Rich.
Thank you. Glad to be here.
Nice to have you. And I'd like for you to meet or speak with Angela. She is my co-host, and as you know, from Boise.
Yes.
Hi, Angela.
Hi. So glad you're here. I loved your email. It was very touching. And I appreciate the follow-up you sent and the article that you shared with us. So maybe you can talk a little bit about that as well.
Yeah, that was an excellent article. In fact, I'll post a link to that with the podcast description so people can read it. But it was an article written by Dr. Lauren Rissman, and she described an evening when she, I guess, was walking home from work, and if I got this right, she was walking across a bridge, and as she was at that bridge, it occurred to her why so many physicians might commit suicide. And she described various aspects of her profession. And it was really a very well-written article and very moving. So, Rich, why don't we begin? If you could tell us a little bit about yourself, your history with substance abuse as a physician, and wherever you might want the conversation to go. We'll just let you begin.
Sure, thanks. I'll just start, I guess, with the traditional AA story by way of introduction. I grew up in New York, relatively humble beginnings, and had loving parents, had good family. No, they were not alcoholics or had any trouble with substances, social drinkers at most. We had a pretty happy family. I think I was one of the last generations in New York City who grew up with, grandparents a few blocks this way, aunts and uncles, everyone kind of in the same neighborhood, almost walking distance. And that was a nice upbringing in my earlier years. Moving on to my father ended up going to medical school. My mother was a teacher. This is back in the mid 70s. I was young kid, and my mother got into spirituality. And one thing my mother and I share is we don't do anything halfway. When I was a kid, when I thought about, I was raised Catholic, and I was a, pretty observant Catholic, as was my family. I not only had to be a good Catholic, I wanted to be a priest. And I wanted to be a priest until I was 16. Um, and, I didn't want to be a pilot. I had to be an astronaut. And I couldn't join the Army. I had to be a Marine, kind of. So extremes were always kind of part of my story, even at a young age. And my mother shares that with me. So when she got into the 70s, kind of alternative culture, Eastern mysticism, New Age kind of stuff, she went all in and she became an interfaith minister. And basically, in my teenage years, our house became a commune. Um, uh, I would come home and never knew who was going to be there. I would find people basically in my room, in my bed sometimes. And by this point, my father was a doctor, still pretty conservative, he gave it a try, but he just couldn't get into it. My mother was totally into it. And, it was clear to my sister and me that, things were starting to fall apart. I went to college. I ended up getting divorced. They ended up getting divorced. A lot of anger on my part, all in retrospect. With years of therapy, have I uncovered all this, not apparent to me at the time. And in college, I was a drinker. In the 80s, drinking culture, movies and such, the college drinking culture was, glorified. And I dove into that. And I surrounded myself with my college buddies who drank, and we all drank. And I probably was, at the far end of the spectrum. And I remember in college, towards the end, that was scaring me. My grades didn't suffer. I didn't get thrown out, but, it was scaring me how much I drank. And I got out of college, kind of worked some jobs, and I stopped drinking entirely for a number of years. Then slowly kind of got back into it. But I was, in the big book terms, I was able to drink like a gentleman, and, had a little wine on the weekends, nothing foreboding, no cravings or anything. So I finished medical school, did my training, did fellowship, all drinking like a gentleman. And I ended up taking an academic position. And I think was very idealistic about what I hoped to accomplish. And academics was, for me, a very rough place. It was a rough career path to establish myself in a way that I wanted to go, and still support my family. Academics doesn't, pay very well relative to, other private practice and such. And I ended up, after about 8 years of doing that, I ended up having pretty bad depression, and sought counseling. Actually ended up in a place for physicians in the great state of Kansas, and got my depression treated. Was seeing a psychiatrist. Everything seemed to be going well, but things at work just were not. I was not gelling with the culture. It was part of it. I ended up losing that job in a very inglorious way. Basically, when I was out there being treated for depression, my counselor told me that my employer, the university, had decided to let me go. So they didn't even tell me. My counselor told me on the second day I was there, and that was devastating. And so finished that. Was still going to therapy. Drinking, not really an issue at that point. Ended up taking a job in a Western state and living in Vermont. So I was commuting across the country for 10, 11 days a month. I would live there, work continuously for 10 days, go home, and that's the way it was. And boy, I recognize it now. I was the poster boy for risk factors for developing an addiction. I was isolated, and not only isolated when I was working, but isolated at home because I no longer felt part of my community. I had been very active in the community, and when I lost my university job, kind of a lot of those activities fell away. And I was isolated there. I was working all the time. They ended up making me director, and it was nonstop stress. And I can remember, after all those years of drinking like a gentleman, I can remember just being home and just being unbelievably stressed and just pouring myself a scotch. And boom, a lot of your guests have talked about that. Oh my gosh, that warmth and that relief. And then from there, it was a cliff. It was, 3.5, 4 years of just steady nosedive into, daily drinking and hiding my drinking and having my family confront me and just and denials and lying and all of those things. And I was never a blackout drinker. I was what I refer to in meetings as I was a cruise altitude drinker. Wake up, take the edge off, and keep the edge off for the rest of the day. Go to sleep. Maybe have trouble sleeping, have a little bit more at night to help sleep, and there it was. And that's the way I lived for those few years. And finally, I was at work. Someone smelled alcohol. They called the chief of staff. He came down, escorted me to employee health. I blew a breathalyzer and had blood drawn and was relieved of my duties. Rightly so. And from there, I ended up in rehab and a very hardcore 12-step rehab, which, I didn't know anything about. I had explored AA online, and I never got past the opening page because it was God, God, God. And I had long since, through my teenage years with my mother, I'd explored Buddhism and obviously raised a Catholic and all of that. And I decided I really wasn't anything. But I saw that page on AA and I went, that's not for me. And I had this view of AA at the time that it was a bunch of old guys in gray flannel suits and fedoras smoking in a basement somewhere. And I wasn't one of those guys, and So I went to this rehab, and I remember walking in the door, and they said, and as part of this is we'll give you a big book. And I, kind of went, a big book of what? Um, and so I went through that, very, very hardcore, very traditional. It helped. I did have another kind of great experience almost on my first day there, where I wasn't drinking. I hadn't been drinking for about a month, and I had been seeing a psychiatrist all this time, obviously not having told them that I was drinking, that drinking was a problem. And like in this one day, like everything she told me for the last 5 years made complete sense. Like I heard it, but I never internalized it. And everything she told me just made complete sense. And from then on, really the compulsion, again, in the language was lifted. And I got home, and I got back to Vermont, and I remember my first meeting. So I'll set the stage a little bit. December 23rd, I got home from rehab. My whole family, extended family, was in my house to celebrate Christmas. So I roll into rehab to, 20 people in my house. The next day, Christmas Eve, is my first AA meeting. I didn't know where it was. I didn't know how to find it. I walk in, it's a small town. Everybody knows everybody. And I walk in, and there's a woman I knew because from Little League from years before. And she walked in, and she just looked at me and threw her arms around me and said, "I'm so happy you're here."
No.
And that just relieved everything. And from then on, it's I felt more comfortable. I got a sponsor, and he's an agnostic, and started an agnostic meeting. And then, very early on in my recovery, I went into the agnostic AA issues and or agnostic AA program, and it's really been wonderful. So that's kind of my story.
Well, cool. Thank you. And so you were on, your hand was forced then basically to get help. It wasn't like, I don't know. Do you feel like that there were issues surrounding your profession that was preventing you from seeking help? Or was it just like in my case, it was simply denial? I just wouldn't admit I had a problem.
Oh, yeah. I mean, the denial was unbelievably thick. And that was part of it, but the professional consequences were, potentially, dire. And I, on every license application, you have to answer questions about drug and alcohol use and mental health, not about other things, not about other physical problems you may have, or medical problems you may have, just those things. And, you hear stories, I hear stories all the time from my fellow physicians who have asked their colleagues, about getting help, and they're actively discouraged not to, because it could have a negative impact on their career.
So yeah, I've talked to nurses before who have had substance abuse issues and have had to go to treatment, forced by their employer to get treatment. And it was a very stringent follow-up program that they had to go through for years to keep their license to practice nursing. It was very, very strict. Did you have to do anything like that?
Oh, yes, I'm doing it. I'm doing it right now. And I get tested randomly for not only alcohol, which is the only thing I ever was my substance of choice, but for anything else, I have mandatory counseling, mandatory psychiatric visits, I have a monitor. I have a workplace monitor who is a fellow physician who is familiar with the work I do in my specialty and has to fill out monthly fitness reports on me. So yeah, it is, and that is for most people, it's at least 5 years of that.
Yeah, that's a lot tougher than what most people would have to deal with, when they're in recovery. But when you were going through that, and as you go through that, your colleagues, I suppose, are aware of what you're doing, and are they supportive?
It is, well, some are and some aren't. And like everyone at work, everyone who I work with, nurses and everybody, knows I don't drink. But no one has ever asked me why. It's not it's kind of, we're as, alcoholics, part of the disease is we become untrue to ourselves, I think. And, I've always been the nature boy, granola, vegetarian guy. And the fact that I don't drink just kind of fits in with my persona. It's with who I am. And so not drinking is not the aberration. Drinking was the aberration, was the inconsistency. So some people know, some people don't. And that's actually something that I have struggled with. I would like to come out at some point and talk about it in a much more open way with my colleagues and with the medical system that I work in, and hopefully help, encourage other people who are struggling to get help. And I just don't, it's incredible that, the job I have now, the doc who hired me, he basically hired me right out of rehab, and he gave me a chance. And he just retired, and I took his position as director. And at his party, I pulled him aside and I said, I would just want to thank you for everything you've done for me, taking a chance on me, and helping in my recovery. And he just looked at me and he got teary-eyed and he said, it's just the best decision I ever made. And I think in our profession, there are not enough people like that out there, who are willing to see, 20% of doctors in a recent survey, 20% in the past year on a questionnaire flagged positive for alcohol abuse or alcohol use disorder. So 20%, it's a big problem. And it's one that's not being addressed.
Johnny had a question in our chat room. He wanted to know, is there a 2 strikes and you're out policy for doctors?
You're monitored for 5 years. And if you're not, and if you test positive for anything in 5 years, then you're monitored for life. Other states are stricter. Some are less strict. It just depends on, it's very much a state by state basis.
And by the way, the phones are open for those of you who want to call in. If you are a healthcare professional and you'd like to share your story, what you are going through as a healthcare professional in recovery, or if you have a question for Rich, please do call in. The number is 844-899-8278.
So, Rich, do you go to meetings, AA meetings specifically for physicians in recovery?
Yes. Yeah, there are meetings. There is an organization called IDAA, International Doctors in AA, and they're called caduceus meetings, and they are specifically for medical professionals. And they, most states, the state I live in Oregon, there are, I think, 3 around the state. So they're not very common, but they are around. But IDAA is a great resource for health professions in recovery.
I was reading as I was getting ready for this that a problem that's even worse than alcoholism among physicians and is at a higher rate than among the general population, healthcare workers in general, is drug addiction, opioid addiction. And what I read is that there are a number of reasons for that. One of those is just the accessibility to drugs. I wonder if you've noticed that.
Yeah, and that is true. It's accessibility is one issue, and it also kind of depends on your specialty. Anesthesiologists, for example, have access to and have a higher tendency to use opioids. ER docs tend to favor cocaine, marijuana, but the number one choice across all specialties is alcohol. So there are some specialty variations, but alcohol and opiates are far and away and anxiety medicines, benzodiazepines are make up the majority of addictions in physicians.
And a fun historical fact, I did not know this until I was getting ready to speak with you, Rich, but do you know that ether was first used in surgery as an anesthetic in 1842 by a surgeon who he was familiar with it from his recreational use of it, and they called it ether frolics. It was Crawford Williamson. Isn't that interesting that already back in 1842, you had a physician who was, I don't know if he had a problem with it or not, but he was certainly using it recreationally. And he said, you know what, this might work. This might help me take that tumor out of my patient's neck.
Yeah. There's actually an interesting thing. Actually, I just read that said that there's some that anesthesiologists get exposed to, just the gases that they use to anesthetize patients, and it's thought that recurrent exposure to that may sort of trigger or facilitate opiate addiction. So it's a theory. I don't know if it's been proven, but it's interesting to me.
Yeah, I would imagine the stress of, pretty much any of the healthcare professions contributes a lot to it as well. I mean, there's so much at stake that I could easily see. I mean, there wasn't much at stake when I was, using or anything, and I still wanted to escape reality. But I imagine that, when there is a lot at stake, that option is probably, given higher priority for a lot of people to escape things. Do you know if we have one person who asked how the pandemic affected alcohol addiction rates of healthcare workers. And you had mentioned in your email that you were really concerned about your colleagues and people in the healthcare field. What are your thoughts on that right now? Are you seeing it in your own area, or is it, just in general?
I think it's too early to tell. For us, it's just, it's for healthcare workers. I mean, it's just starting. We're over the peak now. Now we're entering the chronic phase, and then there's going to be, a lot of people think there's going to be another peak. The horizon for us on this is not yet visible. Mm-hmm. and that is certainly a stress. And I think, like I alluded to in my email, this, hey, we're as egotistic as everyone else, and we love the praise, and people banging pots and thanking us. When I come home in scrubs and whatever. I like that, but like I said, that is a lot to live up to. And I think for many of us, medicine has changed in a way that is going to be difficult for a lot of people to readjust. And, and to get to Angela's earlier point of, stress is one thing, but it's also the personalities that medicine attracts.
Yeah.
We are perfectionists. We are perfectionistic. And not only are we perfectionistic, we're perfectionistic in a profession that demands perfection. Mm-hmm. No one wants to see their doctor and be told before they go in the room, he didn't sleep well last night. He's kind of having a bad day. He's really not on his game today. Right. That's not the way it works. And so, so we're perfectionistic, we're compulsive, we're, all of which are attributes that are, in one way, very helpful in the profession, but in another way, very self-defeating, because perfection is an illusion. Having been here doing this many years, you can go through and re-examine any patient's chart and find, little tiny, errors and that have no consequence. But if you're a perfectionist, then that's a problem. And so not only is it the pressure we put on ourselves, kind of the personality that goes into the field, but it's the expectations that is put on us from without, from society. And now that that expectation is, with the pandemic, is being even elevated further, mm-hmm. that's where my concern comes in for my colleagues. Nurses especially, nurses working 4, 5, 6 shifts, 14-hour shifts, go home, pass out, go home, fall asleep, come in and do it all again. Where's their time to decompress? Likewise, other people in the field.
Do they talk about it within, your division or your supervisors or anything, like, trauma resources or employee health? Is there anything in there yet?
I have seen a big outreach of promotion of, EAP and, clinician resources and all of that is available. I mean, the fact is that it's always available. Mm-hmm. It's the problem of healthcare workers in general to not ask for help.
Hey, Rich, we have a caller. We can take this call. See who this is. Hello.
Hi, John. This is Dale.
Hey, Dale.
Hi. I was just wondering if there's some set criteria where a doctor might lose his license because of addiction, and how often this happens.
Oh yeah, there are definite criteria. Most of that is up to the state, for monitoring boards. And like I said, some of them are very strict and some aren't. But if you're in violation of your monitoring or your monitoring agreement, your name is published, and the plan is, your remediation plan is published. And then if the board decides that it's appropriate for you to lose your license, that is also published. So it's all public record. How often it happens, I get my newsletter from the medical board, every month, and there's always a list of people who.
Rich, I've seen that. I was actually researching a doctor who gave a talk on YouTube, and she had that happen to her where she had a problem with addiction, went to treatment, whatever happened, but it was made public. And then they have this website where people can go to check out their physicians, right? And she came up as one of the people that had this problem or whatever. So it's like that is, I mean, I can understand why you'd want to have that, but that is certainly stigmatizing.
Exactly. The idea is that you get help, you get, monitored, with your recovery program, very closely, and you stay in compliance. And if you do that, then your name is generally not made public. But if you're in violation, then it can be made public. That can be an extremely shameful experience, and a big deterrent.
One might not voluntarily want to go seek help if they realize they have to go through this 5-year program and constant monitoring, and if they fail, it's publicly acknowledged. I can see how that could
be
an obstacle. Absolutely. Yeah. Dale wrote a book. It was like it's like a secular version of the Big Book. And Dale, I was thinking as I was talking to Rich about that story of Dr. Bob when he went to operate on somebody and they had to give him a bottle to keep his hands steady. How would you like to be that patient?
Yeah.
I think Dr. Bob needed some monitoring. Well, thank you for calling, Dale. It was nice to talk to you. How you doing over there anyway?
I'm doing fine, John. Thank you very much.
Well, thank you for calling. I appreciate it.
All right. Take care.
The phones are open, so please do feel free to call in. The number is up there. It's 844-899-8278. So, I was going to say something when you were talking about how the impact of COVID, and I was thinking about that as before our podcast, that I also think is going to be after this is over, because right now you're just you're dealing with what's in front of you, but there will be a post-traumatic stress syndrome, like returning from a war, I think is what will happen.
Yeah.
That I agree with that. Yeah.
Yeah. I do think that there's more awareness for healthcare workers regarding healthcare and trauma, but I don't know that necessarily all the resources are there. I have a friend who works in ICU, and that they were going to seek some trauma resources for just that job, is very traumatic sometimes. And that in this area, there really weren't any, which was surprising because we've had several first responders commit suicide in the last couple of years. And so there was a big community thing of we need to have, resources available for first responders. But when this person called to get those, they really didn't have any licensed counselors that specialized in healthcare and trauma and stuff. And so the person had to seek things outside of what was provided within their employee system. But, I think that I have heard that people are at least doing that now, trying to seek out trauma. And when they do that, I don't think they have to admit that they have any sort of, addiction problems. And so it's not looked at as badly on. So a way for them to get help without having to get the attached diagnosis or.
Yeah, I think it's something that I think patients as well as healthcare people have to advocate for, and because it's not a big stretch to think of how stressful all of this is on healthcare workers, and it can be rather system dependent. When I was at the university, there really wasn't anything like that, like your friend is experiencing. There really wasn't a great system. Where I am now, after a stressful event, we have an immediate debriefing and then a debriefing a week later with a mediator, and everyone comes, and it's, it is unbelievably helpful.
Sounds great.
But I think all systems need to definitely have that mechanism in place or to provide support. And we as healthcare workers, we have to get out of our own way, ask for help. And so it's a two-way street. The systems have to make it available, and then we as professionals have to recognize it and recognize the problems and access it. And I think, though, that there's a big issue of trust. That is this going to stay confidential? Is, am I going to be able to keep these issues private? That's a big concern. That's a big concern.
Yeah, definitely.
Another interesting fact, though, is that those doctors, physicians, medical workers, I guess, in large, when they do seek treatment, the success rate is pretty high. I was reading on the internet, there was a study that reported like 81% of some participants in a treatment program were still sober after 5 years after treatment. That's a pretty high percentage of people remaining sober. And I think that percentage of is higher than the normal population. I found that kind of interesting.
That's amazing.
And maybe it's because of just the knowledge that you have.
Yeah, it's the knowledge, and it's the knowledge, and I think it is the support, and the PHP and its ideal role provides some accountability. And I have said in many meetings that I completely respect people who got sober on their own. Just, I can't do this anymore. I'm going to meetings and did it. I have to answer to a lot. And I have a lot of people and a lot of systems keeping me on, the straight and narrow, at least externally. But the people, I think you and Angela, you've done it on your own. I completely respect that. That's not an easy road either.
Do you happen to know somebody from Vermont by the name of Peter T?
I wasn't gonna drop his name, but
because he just posted a really cool story. He said that he says he is really cool. He says he can't help but connect the dots. He said John and Ben's podcast inspired him to become out as an atheist or an agnostic in recovery, and then he attended the convention in Austin where he met me and Ben, and he met Dale, and that inspired him to start the meeting in Vermont, which is how he met you.
Yeah.
And then you heard him call in on our podcast, and you connected back with him.
I did. And I was at one of my meetings. I did the 90 and 90. Well, actually, to come clean, because I'm a perfectionist, I actually did 89 and 90 because on the 90th day I had to fly out here for my job interview, so I couldn't make a meeting. But he made an announcement at one of my meetings. I was probably out of rehab about a month, not even, that he was starting an agnostic meeting, and I didn't get to the first one, but I believe I got to the second one. And yeah, that was home. That was home. And he was actually, not to tell tales out of school, but he was my first sponsor.
Oh, cool.
Very cool.
And he was incredibly good at talking me off the ledge. When I would go to a traditional meeting and get outraged about something that was said, he was good at, you don't have to think that way. That's not the way everyone thinks. And he was an incredible resource.
Another little known fact about Peter, he has an app. I think it was called, what is it? AA Bingo, I think, or something like that. And it was like, if it's still online, I'll have to put the link out there. It's really kind of funny, but it's like you play this game so that anytime you hear like a certain phrase in AA, you get it, or it's like a bingo game. It's kind of funny.
Sober bingo.
Sober bingo. That's what it is. Yeah.
Nice. A friend of ours, Tracy, is asking about if medical doctors who are like in that program, I'm sure it varies by state, but do you know if any of them are allowed to seek out and use medically assisted treatment?
Yes.
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 Thanks for saying yes before I had to try to pronounce the words.
Yeah, it's all right. I have trouble with some of those too. But actually, when I was in inpatient, it was offered to me that I could take Suboxone. Yeah. And I declined it. I didn't feel like I needed it at that point. But yeah, medication-assisted treatment is accepted. Yeah.
Oh, that's good. I'm one of those all of the above to try to help people because it's not a one size fits all with addiction.
Yeah, I am too, and it makes sense that they would. That was a really good question though, because it makes you wonder. But what is used to treat addiction isn't itself addictive or problematic at all anyway. So I wouldn't think it's a medication that, like any medication for any problem, needs to be managed, properly and expertly. Mm-hmm. I'm with you. I mean, all of the above works. So another question I had for you, I was wondering if you, just in your practice, do you run across patients who have substance abuse issues? And do you think that your own personal experience kind of helps you in guiding them if you do have these patients?
Oh, absolutely. Unquestionably, my perspective has changed, and not only with substance issues, but as someone with a dual diagnosis, depression and substance, that my perspective has completely changed, and I have spoken privately to patients who are going for inpatient treatment and said, "You can do this." I don't tell my story, but I say I have some experience with this, and I speak in general terms, and I think that has been helpful for some of them. I hope it has been.
And I read, and I think that this is probably true. In fact, I got this from Dr. Ray Baker, that in Canada, there's very little education given in medical school about addiction and addiction treatment.
Absolutely. Very. I mean, I can just speak for myself and say, basically, you hear that this is a while ago, you heard the terms methadone. And in residency, we would do acute detox for alcohol. But that you kind of learn on the fly. When I was at the university, I taught in medical school, and as far as I know, there was very little of the curriculum devoted to that.
So it's good that you have that you're able to use your experience in a positive way anyway. So we're coming up on an hour here pretty soon. So I think we can wind things down. I do appreciate you coming on the podcast to talk about your experience, Rich. It was really interesting, and it's a lot to think about. And in particular, what you said about how healthcare workers are seen as heroes and lifted up. It just reminds me of how veterans felt coming back from the Iraq War and being thanked for their service, and just having that, I don't know, that feeling of somehow being different and not having the same experience as the rest of the population. And that's kind of what healthcare workers are dealing with now. They're on the front lines dealing with a huge problem. I mean, we're all in this together. We're all in our isolation and so forth. But, I don't have COVID patients breathing on me every day.
Yeah, and I think same as similar to the veterans, you don't want to let people down. You feel admired and respected, and again, a lot to live up to, admitting that, you're having difficulties, feels a little bit like letting people down, letting the people around you, your coworkers, letting them down. And then that can be a very shameful experience. And we all know what shame begets.
Right. And I can kind of see, on a much lower scale, kind of like when you have been sober for a little bit, if you, show emotion or go through a tough time, sometimes it's hard to talk about it because, you've got a little bit of time, and people with some sober time shouldn't be having these kinds of problems. So, So my last question for you, though, is, for those of us in recovery, how can we support our healthcare workers during this, both in recovery and outside of recovery? Do you have any suggestions of things that would be helpful for us so that we can be community and support them in a way that's useful to them?
Well, I think you, Angela, you mentioned that you have some friends who are healthcare workers or people who are healthcare workers. Yeah. Really checking in with them as you can on a deeper level than, hey, how's it going? Really kind of, let them know that you care. Let them know that, empathy. I guess that's the thing, is empathy. That essay I sent you guys, that she talked about, she finally spoke up, and other people said, yeah, I'm having a tough time too, and she was expecting scorn and shame, and she got a lot of empathy reflected back. And I think just being open and listening, whether they're in recovery or not. And you may hear some things that you may not want to hear, but just being there and listening.
So like holding space for them. So even if it's a tough thing to hear, and they may be struggling with it, or it's just a tough thing in general, being willing to hold the space for them that they can talk about it, and you won't fall apart.
Exactly.
Okay.
One final question for you, Rich, that is coming from Johnny, and you may have already answered this, but he's just kind of curious what you think about naltrexone.
Again, everything is on the table. It's, as far as I know, for alcohol anyway, it's an off-label use, I believe. Don't quote me on that, but I have had friends in recovery who it has really helped. So I think, I think again, supervised, someone who's supervised by someone who's an expert in its use, and it's, I think it can be a helpful tool. I try not to, the same as in a meeting, if it works for you, I'm all for it. Even if I don't agree with it or it's not for me, whatever keeps you going.
Well, Rich, thank you again.
Thank you so much.
So,
thank you.
That's it. That's another episode of AA Beyond Belief, the podcast. Thank you, everybody, for listening. Thank you for our patience. I think that the internet machine wasn't working so good for us today, but that's okay. We all had a good time. So one last thing, thank you, people, for donating to AA Beyond Belief. That's been fantastic to see the extra contributions in our Patreon page. I mean, the Patreon wasn't doing anything for a long time, and now we're getting a lot of these dollar contributions. And again, I just can't tell you how much that helps. So if anyone out there wants to do that, just make little $1 a month contributions. You can do that at patreon.com/AA Beyond Belief. And that's something we really do appreciate. So thank you, everybody. Thank you for giving me this opportunity. Thank you, Angela. Again, it's always great to have you on this podcast with me.
Thank you for letting me be a part of it.
And thank you, Rich. And best of luck to you as we somehow make it through these difficult times ahead.